People have a lot of questions, and I think you had a lot of questions about cholesterol, what that means, why it's something that we have concerns about, and what the effective strategies are lowering the cholesterol are, what the benefits to your overall health are, and why do we have cholesterol in the first place. So cholesterol is something that we use in our bodies in multiple places. It's essential for our skin, our brain, many of our immune defense systems, but later on in life it can become a problem because this barrier, that's this essential ingredient for our defense systems, has an irritating effect on our vasculature. For some people, they're blessed with a vasculature that isn't particularly bothered by it. So some people have reasonably high, normal levels of cholesterol that their vasculature is able to resist. For other people, even a moderate amount of cholesterol can help trigger a series of inflammatory events in their vasculature that can make that life-threatening. So we try and look at not just the number in terms of what I think most population studies look at, a normal versus high cholesterol. And that looks at what the predictive value of that number is in a large population. However, most people want to know what that number means to them. And so to do that, we look at their health of their vasculature by CT and ultrasound to see what the level of cholesterol that they have in their bloodstream is doing to their arteries, or has done to their arteries. Then we know that cholesterol is part of the pathophysiology of cardiovascular disease. And we know if we remove that, we're going to slow the progression of cardiovascular disease. So there's several different strategies. There's diet and exercise. But honestly, the diet and the exercise tends to be more effective in making the arteries more resilient and has only a minor effect on actually your circulating cholesterol. If you want to drop your circulating cholesterol, you really need to affect how much is being produced by the liver. And that's what the statins and the other agents do. There are other agents that bind it in your intestines so you kind of poop it out more. But really, to have a big effect, you've got to affect the liver. What's interesting is that people have different kinds of cholesterol. There's some that's really defined by their genetics, and there are others that's, really how aggressive their liver is in producing it. Even if you have the genetic kind, the lipoprotein little a, and we know you have cardiovascular disease, we want to be driving down the ApoB. And the ApoB is one of about 100 different LDL cholesterols. So when you go to your doctor and you get LDL cholesterol, that's a surrogate really for the toxic cholesterol that we can affect with statins, called the ApoB. And when you see pictures of coronary artery disease and you see that yellow plaque that looks like a sty kind of thing, that's really the ApoB cholesterol. And it's really the protein coating around that cholesterol that determines how toxic it is to your vasculature. So when we're trying to maximize a person's health, their ability to resist the progression of cardiovascular disease, for the most part, we're trying to drive down this essential component for the progression of cardiovascular disease, the ApoB.